Hello everyone, my name is Rachel and today I'll be presenting on emphysema, a chronic respiratory condition that forms part of chronic obstructive pulmonary disease or COPD. This presentation is designed for graduate registered nurses and enrolled nurses and will cover epidemiology, pathophysiology, pharmacology, and a nursing care plan for an acute exacerbation. So this is our case study. His name is Michael Roberts. He is a 60-year-old retired construction worker with emphysema. His reduced breath sounds and diffuse wheezing highlight the chronic destruction of alveoli. This reinforces the importance of nurse-led management strategies, including bronchodilator therapy, patient positioning and breathing techniques, and education for long-term self-management. He will be referred to throughout this presentation so that we have someone to base it off. Starting with the epidemiology, in Australia, COPD affects around 5% of people aged 45 years and older. The burden is higher in men, people living in rural and regional areas, and those from socio-economically disadvantaged backgrounds. Globally, COPD is the third leading cause of death, with emphysema making up a significant portion of this burden. For nurses, these figures mean we'll encounter emphysema regularly, requiring us to deliver care that is evidence-based, equitable, and accessible. Now let's look at what this means for a nursing practice. Firstly, early detection is crucial. Nurses are often the first point of contact in both primary care and hospital settings, and we play an important role in encouraging and facilitating the use of spirometry for diagnosis and monitoring of COPD. Secondly, because emphysema is a chronic and progressive condition, there is an increasing demand for long-term chronic disease management. This places nurses at the center of coordinating care, monitoring symptoms, and ensuring continuity between primary and tertiary health services. Finally, there is a strong emphasis on patient education and supporting self-management. Nurses need to empower patients by teaching breathing strategies, reinforcing correct inhaler techniques, and ensuring equity access to services, particularly for people in rural and lower socioeconomic areas. So the implication for us nurses is clear. We have a vital role in early detection, ongoing management, and patient empowerment. Emphysema is characterized by irreversible destruction of alveolar walls, which reduces the surface area for gas exchange. The loss of elastic recall in the lungs leads to air trapping and hyperinflation, causing the characteristic called barrel chest. Patients develop dyspnea, wheezing, and chronic coughs. For Michael Roberts, his 5-year history of breathlessness and wheezing is explained by this alveolar damage and airflow limitation. A first-line medication in emphysema management is salbutamol. It's a short-acting beta-2 agonist. The mechanism of action is stimulating beta-2 receptors in bronchial smooth muscle. This leads to the relaxation and bronchodilation. So some indications for salbutamol is some provides relief for acute bronchospasm in COPD and asthma sufferers. Some nursing consideration is to monitor for tachycardia, tremors, and hypoklemia. You should also check inhaler techniques and caution against overuse, which may reduce efficacy. For Michael, salbutamol is important in managing acute breathlessness. For an acute exacerbation of emphysema, the key issue is impaired gas exchange due to alveolar destruction. The main goal is to maintain oxygen saturation within the target range of 88 to 92%. Some interventions for Michael is to administer salbutamol as prescribed and monitor effectiveness. The rationale is that salbutamol should promote the bronchodilation by relaxing airway smooth muscle. This reduces bronchospasms, improves airflow, and alleviates dyspnea in patients with emphysema. Monitoring effectiveness ensures the drug achieves therapeutic outcomes while identifying any adverse effects. Nursing actions should involve administering via inhalers or nebulizer as ordered and ensuring correct techniques. Access, respiratory rate, lung sounds, and oxygen saturation, and patient-reported relief after administration. You should always document response and notify the medical team if symptoms persist or worsen. The next intervention would be to position the patient in a high Fowler's position to optimize lung expansion. This is because upright positioning uses gravity to reduce pressure on the diaphragm, allowing for maximal lung expansion. This improves ventilation, oxygenation, and comfort in patients with obstructive lung disease. Some nursing actions to observe is to assist Michael in a high Fowler's position with pillows for support. Reassure him during repositioning to reduce anxiety, and reassess oxygen saturation and respiratory effects once positioned, and maintain a safety by ensuring bed rails are adjusted properly. The last intervention is to encourage and support pursed lip breathing. This helps slow respiratory flow, prevent airway collapse, and reduce dyspnea by improving gas exchange efficiency. Nursing actions to observe is to teach Michael how to inhale through his nose and exhale through pursed lips. Provide coaching and reassurance during episodes of breathlessness. These interventions directly support ventilation, reduce anxiety, and optimize oxygenation in acute care. To summarize, emphysema is a progressive, irreversible lung disease that significantly impacts mobility and mortality in Australia. Pathophysiology involves alveolar destruction, hyperinflation, and impaired gas exchange. Management includes pharmacological interventions such as salbutamol, alongside evidence-based nursing interventions like upright positioning and pursed lip breathing. Nurses play an essential role in both acute management and long-term education, improving patients' quality of life.